I'm Dr. Eric Kropf. I'm the Director of Sports Medicine at Temple Orthopaedics and Assistant Professor of Orthopedic Surgery. Most people come to you with hip pain with very little understanding of what their problem is. And what that usually leads into one of two boxes. People either have a hip that is either a little too shallow or uncovered. The other end of the spectrum is the hip where the ball and socket of the hip joint have a mismatch, where they will impinge or abut in some positions. We call that femoroacetabular impingement, or FAI. The group of patients who have FAI or labral tear, they fall into usually two distinct populations. There's very young, the young patients, 15 to 25, who are very highly active, and they are really just pushing their hip probably beyond what it should be doing. The other group of patients is the patients who got through that age group and now have just sort of either modified their activity or they're getting sort of back into activity in their 40s. And they're the patients who will see other physicians and are told, you don't yet have arthritis, but you need to live with it. And you probably will get arthritis. And at Temple, we have at our fingertips, we have access to high resolution imaging in all fashions. We have special MRI sequences that look at your cartilage very closely. So I know exactly what's wrong with your hip before I have to put a scope inside it and see it. Historically speaking, when we were treating hip problems, there was the option of hip replacement or physical therapy, and there wasn't a whole lot in between. Hip arthroscopy has evolved over the last 15 years and become commonplace at larger academic centers, but it's still relatively uncommon in the US. Arthroscopy is when we use small specialized cameras and instruments to go inside your joint without requiring an open incision. So we do not need to release muscle. We do not have large incisions. So we're going directly to the point of your problem, and this allows for very rapid recovery for patients because there is not a significant amount of muscle or capsule or other tissue that needs to heal. So the average patient will leave with only 3 to 4 5-millimeter poke hole incisions, 3 to 4 small little sutures, and really early on has very little pain because there is not a lot of muscle takedown or anything that is going on. The average patient is up and moving on crutches in the same day. They're putting at least some weight down through their foot. Some people will be ready to start to spin without resistance on a bicycle on the next day. People will be walking or even some jogging or other low-level activities by 4 to 6 weeks. I think that at Temple, we are at the forefront of managing athletic hip pain and hip preservation. We fully appreciate the extent of your problem, and we will take that understanding of what's wrong with your hip and then tailor a program that's best for you. And we're going to make sure that we're going to do what you want to do now to get you back and healthy and active and doing the things that you love, the sports and activities that keep you happy and keep you active. But we're also going to preserve your hip so that when you get up into your 40s or 50s, hopefully we are at least delaying, if not completely preventing, the need for hip replacement.